Alaikum. Now the history celiac disease. Uh, Scenario may be GP later referring that Arif 3 years old came diarrhea, mother concern not gaining weight like peers, and grandmom has diabetes mellitus. So first of all, hello, good morning. This is Dr. Roxana, one of child doctor here. Am I speaking to Maria, Arif's mom? Thank you for coming. From GP later, I came to know that you have concern regarding Arif's health. So I will take detailed history of it, and I will try to answer all of your concern if you have. Is it okay? Yes. So Maria, can you please tell me what is your main concern? Yes, I can find that Arif has diarrhea for long periods of time and not growing well. Okay, so would you please tell me more about his diarrhea, when it started, that is changed over the period of time. Okay, so what is the content of this stool? How frequently he opens his bowel? Okay, and what is the consistency? Do you notice is it easily flushable? Does it contains any kind of blood? Okay, so do you think that anything aggravates this condition? Do you notice any swelling in the private area? Any oral ulcer? Okay. And do you are also telling about his weight and height is not gaining. So when you notice it, do you have any growth chart? So for last 7 years, 7 months, his weight and height is not growing. So what did you do for it? Do you follow any dietitian? Would you please tell me about his food habit? Up to when you have continued the exclusive breastfeed? Okay, when this cow's milk is introduced, and when this yes, weaning food is introduced, and which is the type of the feed, and how many time you give to his Arif? Who prepared this for Arif? Okay, so that's he Arif. Then we will ask about this is the completion of the presenting illness. Now the systemic constitutional symptoms. Does Arif has fever? And what's of his activity, daily activity? Is there any sleeping disturbance? Okay, mom, now I am going to ask about the symptoms of different system to make sure that these symptoms is present with Arif or not. Is it okay? Okay, so does Arif lost any become unconscious? Do you notice any yellow coloration of his eye? Do you have any concern regarding his pee? And do you feel any racing heartbeat or palpitation that he complained to you? Does she have any kind of cough? Do you notice any pallor of Arif? Any concern regarding his skin condition? Does she have any joint swelling? Any does she prefer any weather? Okay. So let's go. Does she has any long extending illness or not? Did she need any kind of hospitalization? Any visit, any recent traveling to any area? Any does she under any kind of medical team? Any medication? Does she takes any medication? Okay. And do you have any concern when Arif in your in your tummy? Do you have any concern regarding the birth period of Arif? Do you have any? Okay, so mom, now I'd like to know the event after birth. Does she undergoes all the screening test when his mucus was first passed? Okay, so do you have any concern regarding Arif's development? Okay. And do you have any, does he receive all of his jabs? Do you have, does he has any allergy to any food or any medication? Now I want to ask you about your family and family environment. And yes, so, and are you and are your partner blood related? Any similar condition in your family? How many family members are you? It's a routine question, but I want to know about what do you do for your living? Is it satisfactory? Do you need any kind of help? So, can you tell me the impact of Arif's condition in your social life? Or what is your biggest worry? So, do you think we don't cover anything that you want to ask me? To what is your expectation from us? Thank you for sharing this information with me. I will go. I will go and I will take. I will come and then I will examine Arif, and I wish Arif's speedy recovery. Today I took a history from Mariam, mom of Arif. Arif is 3 years old. He has been suffering from loose stool and failure to thrive for last 2 years, 2.5 years since introduction of wheat in his diet. The stool is this stool is not blood stain, but it is very difficult to wash, and there is no swelling in the anal area, and he has in skin condition there is probably dermatitis herpetiformis, and family history of diabetes mellitus and celiac disease is present, and this disease makes mom's psychologically disturbance. So, what the question may be, what are the differential diagnoses? So, differential diagnosis, celiac disease, cow's milk protein allergy, giardiasis, cystic fibrosis, immune deficiency, inflammatory bowel disease. So, what will be the investigation? Baseline, full blood count, stool RE, diagnostic test TTG, IgA, confirmatory duodenal biopsy, genetic test endomycin antibody and HLA DQ2 and DQ8, and to see the association thyroid function test, random blood sugar, and to see the complication bone profile, iron profile, to exclude other disease, immunoglobulin S. And then how to manage? So, I will do the general examination, skin, airway, breathing, circulation, vital sign, state of dehydration, skin survey, para-abdomen examination, and then after I will check his previous note, and then I will, if there is dehydration, then I will and if needed I will admit the child, and this is a short term management. In long term management I will involve the multidisciplinary team. Team members will be consultant, gastroenterologist, hematologist, orthopedist, endocrinologist, dermatologist, dietitian, genetics for the family screening, social support, and I will also involve the celiac team. And here I will do the counseling of the parents, importance of adherence of the gluten-free diet, and I will we will also assess his growth and for any complication arises from celiac disease, and extra vaccination including the influenza, meningococcal, pneumococcal vaccine. And then condition associated with celiac disease, type 1 diabetes, autoimmune thyroid disease, Addison disease, pernicious anemia, iron deficiency anemia, vitiligo, arthritis. And complication of celiac disease, it will reduce the quality of life, and it will hampers failure to thrive and delayed puberty, bone bone problem, iron deficiency anemia, and there is increased risk of gastric adenocarcinoma and lymphoma, and chance of refractory celiac disease. So, what is refractory celiac disease? Refractory celiac disease occurs in adults, rarely in children. Patient meet all the diagnostic criteria, but with proper adhesion there is no compliance, and or have little compliance, but on subsequently there will be refractory to having the gluten free diet. So the whole would be the management of this refractory celiac disease with total parenteral nutrition, glucocorticoid, azathioprine. Who are the high risks for celiac disease? IgA deficiency, and all the syndromes, Down syndrome, Turner syndrome, Williams syndrome, and the family members have history of having celiac disease. And another is celiac crisis. In celiac crisis, severe diarrhea, dehydration, weight loss, hypoproteinemia, metabolic acidosis, renal impairment, and neurologic manifestation. Celiac crisis, in this case, first airway breathing, I will admit the child, airway breathing, circulation management, involve our consultant, and then start IV glucocorticoid and IV steroid, preferably the budesonide, and gluten free diet. What is non-celiac gluten enteropathy? Its presentation just like irritable bowel syndrome. No, there is abdominal pain, loose motion, but there is no villus atrophy. Serology is normal, and whenever there is gluten in diet, this presentation arises. After removal, it removes. So it is non-celiac gluten abnormality. One recall question was there when we will do the gluten challenge test. So gluten challenge test we have to do if the family history of celiac disease but diagnosis is uncertain, or there is false negative biopsy, but we are suspecting. In this case, then we will give 2 slices bread per day for 6 weeks, and then we will do the serological test. If it is positive, so we will proceed for biopsy. And then the follow-up 6 months annually. Different books has different ideas, but we will follow the protocol of this hospital, and annual follow-up with growth monitoring for the complication, also doing the serology and full blood count, and yes, and types of anemia in celiac disease: iron deficiency anemia due to duodenal pathology, normocytic normochromic anemia because anemia of chronic disease, macrocytic anemia due to vitamin B12 deficiency, and hemolytic anemia for there may be hemolytic anemia. And initial test may be asked because whenever there is a high risk group or patient is symptomatic, so we will do the TTG, total TTG, IgA, and total IgA level. If it is more than 10 of upper normal limit, so we will do for anti-endomysial antibody. If it is positive, if these two are positive, so we can go for the treatment, that is the gluten free diet. But if this is less than 10%, but patient is symptomatic or patient is asymptomatic, but the serology is positive or there is refractory case, in there we can do the biopsy, and the findings of biopsy is subtotal villus atrophy, crypt hyperplasia, interepithelial lymphocyte predisposition, and lamina propria plasma cell infiltration. So, what are the prognosis? Prognosis with good adherence to treatment, prognosis is good, but the prognosis may be reduced. Some patients develop the complications and malignancies. Thank you.